Hi, I am Dr. Abhijit Kulkarni. I am consultant brain and spine surgeon at Apollo Hospitals, Navi, Mumbai. Today, I am here to talk to you about the management of head injuries. Head injury is one of the commonest thing which comes to a neurosurgeon in our day-to-day practice. In times of lockdown, when all of us were stuck at home, the incidence of head injury had decreased. But now, as we are slowly in the phase of unlockdown, in head injuries are again we are seeing a lot of head injury patients being admitted to the casualty department. So head injuries, as you can think of, can occur due to various reasons. The most common being road traffic accidents, collision between a bike and a four-wheeler or between two four-wheelers or skidding of bikes. But the other causes of head injuries could be assault over the head or fall from heights, etc. The patients who are wheeled into the casualty with a history of head injury, we normally divide them grossly into mild, moderate and severe type of head injuries. In the mild forms, the patients are normally conscious and they can talk to us and tell us about exactly what happened. And there is a scoring system which we call as the Glasgow Coma scoring. They are almost on the scale of 14 or 15, which is almost near normal. In the moderate type of patients, they may be or may not be fully conscious. They are a bit irritable or drowsy and they may or may not follow exactly what you are trying to ask them. In the severe type of head injury patients, they are most of the times fully unconscious. They require aggressive management in terms of their airway, breathing, protection, and they require fast and aggressive care. The primary aim in treatment of head injury patients is we have to segregate in patients into two categories: A, which require urgent surgical intervention, and B, which require continued and prolonged medical management. So the basic investigation, which is a rapid thing which can be done very immediately, does not take much time and gives us this information, is a CT scan. The CT scan of the brain will show whether there is a large clot in the brain or whether there is a fracture in the skull which is gone into and depressing into the brain, or whether there is some amount of swelling in the brain. All these things help us to decide whether the patient is in need of urgent surgery or no. If the patient requires surgery, then time is very crucial in head injury patients, because the earlier we operate on the patient, there are more chances that we prevent secondary brain damage. Secondary brain damage is the damage which is an ongoing damage which occurs after the accident, and because of increase in the pressure in the brain or increase in the blood clots in the brain is continued to be damaged. So this secondary brain damage we stop by surgery. The primary brain damage which has occurred at the time of accident is not reversible with surgery. That takes time, the brain heals itself, and that we have to give time to the brain to heal and continue the supportive care at that time. So mostly in cases of severe brain injury or moderate injuries where the CT scan is showing some amount of surgical intervention is required, we go in for a surgery at the earliest. In the other group of patients who require medical management is continued in the ICU, and we start with medications in order to avoid seizures in such patients, in order to decrease the swelling in the brain, and in order to prevent infections, and to protect the airway and all. So all these medications and medical management is continued for patients who do not require surgical management on the CT scan. Now the commonest type of surgeries which are required in the cases of head injuries are: one, to remove large clots in the brain, which can be either extradural or subdural. Extradural clot is a clot which is outside the brain, but it compresses the brain from outside and decreases the function of the brain. So in such patients, if we remove the clot, the recovery is excellent because internal brain damage is very minimal. In cases of subdural, the clot is inside the coverings of the brain and it compresses the brain. So when we have to remove it to reduce the pressure over the brain. But in such cases, there are high chances that there is associated brain injury also in cases of subdural. So it is not just only removing of the clot, we have to continue with management for the brain injury also. The other type of commonest operations which are done in head injury patients is a depressed skull fracture. It is a fracture which there is a fracture in the skull and it is depressed and it is penetrating the brain parenchyma. So there are two things. There is a high chance of seizures in such patients, so we have to elevate the fracture. And secondly, because the dura mater, which is the covering of the brain, is ruptured because of the fracture, there are chances of outside infection going inside the brain and causing what is known as meningitis or brain infection. So, because to avoid both these cases, we need to operate on these patients, elevate the fracture, we repair the covering of the brain so that the chances of infection and seizures are avoided in these patients. In some head injury patients, there is lot of severe brain swelling in the one side of the brain, which compresses on the other brain and decreases its function also. In such patients, what we do is known as a decompressive craniactomy. In this, what we do is remove a part of large flap of the skull so as to reduce the pressure in the brain. Once the pressure in the brain is reduced, at least the part of the brain which is not damaged with the injury, it recovers slowly. So these are the multiple operations which we do in cases of head injuries. But after the surgery also, it has to be remembered that aggressive ICU care, good ICU care, medical management has to be continued in these patients for better outcome. Also, once this acute phase of head injury and surgery or medical management is over, many patients are left with some sort of neurological deficits in patients with head injury, especially the severe ones, because there is primary brain damage, as I told you, at the time of accident. For these patients especially, long-term rehabilitation and physiotherapy are the crux of further management, because with for example speech therapy and other types of physiotherapy, these patients they are able to recover in their lost neurological functions slowly. So even after this acute phase is over, the rehabilitation and physiotherapy forms a very backbone of the recovery of such patients which are left with neurological deficits after head injuries. At Apollo hospitals, we have an integrated team where the neurosurgeons, the neurologists, orthopedic surgeons, if at all there is associated fracture in patients with head injuries, ICU team, physiotherapists and rehabilitation specialists, we work together for a comprehensive management of these patients. Thank you.